Welcome to Networking Arizona with host Carol Blonder. You'll hear interviews with businesses located throughout the valley. Networking, it makes a difference.
If I traded it.
So welcome to the show, everyone. As all of you know, I made it possible for you to talk about yourself on the radio. And I am so excited about networking with everyone today. My first guest, if everybody knows that a lot of us are trying to get ready for the summer, and a lot of us are really sorry about having to put our shorts on. Listen up, everybody. My first guest is Dr. Glenn Halverson, and he is the owner and medical director of START Clinic. Welcome to the show.
Thank you, Carol.
All right, tell everybody a little bit about yourself. And today, we're kind of going to go narrow and deep on something really important. So tell everybody a little bit about yourself and what you do.
Well, we recently opened up START Clinic. We're focusing on weight loss and fitness as opposed to weight loss and vanity. I think my bias is weight loss and fitness because I also happen to be insulin-dependent diabetic, and I'm a musculoskeletal physician. I've spent 30 years in sports medicine, and most recently I've been doing nerve tests in pain management clinics. And one of the things that disturbed me were all of these diabetics that we were seeing that didn't even know that they had peripheral neuropathy. And then I would diagnose peripheral neuropathy on other patients who didn't realize that they were most likely diabetic as a cause of their neuropathy. So you have a conversation with them, a friendly conversation. You find out that no one's really giving them much guidance. They don't realize that type 2 diabetes, for example, is reversible. It requires lifestyle changes, requires losing weight, changing your numbers, basically. If we can get a woman to reduce her waist size under 35 inches or a man to reduce it under 40, we reduce their chance of getting diabetes by 10 or 11%. We also significantly change their other health risk factors, what we call comorbidity, whether it's elevated blood pressure, elevated cholesterol, risk for heart disease. A diabetic over the age of 40 has 6 times the normal risk for dying of a sudden death from heart attack.
Sure. Now, with diabetes and being overweight, I mean, some of it is it all that person's fault of just the way they're eating, or how does that happen?
Well, I think the number one cause is our cultural addiction with sugar.
Tell us about it, Doc.
Oh, sorry. Yeah, we eat too many carbohydrates. I remember at the age of 6 sitting at baseball games with my dad, and the treat was Pepsi and peanuts. And you develop a lifetime addiction there for Coca-Cola or Pepsi, and you think it's a normal cultural thing to do, and yet it's very negative for your body in terms of long-term health effects, but you also get used to that sugar high, and it's very difficult for people to want to change those habits. Right.
Now, we're going to open up the lines to the audience, and there's something that you're doing that's really interesting today that you're going to be giving away. And this is an energy shot, and it contains a lot of different things. And I want you to tell everybody about what it is. Because first of all, let us all admit that we are all dying of, we need energy. We're all very sluggish for whatever reason, because of what we're eating, I guess.
Well, that's why we take the 5-hour energy. That's why we use the Red Bull and the Monster and the other drinks. And unfortunately, as Americans, we think of a little is good, more is better. And as a result, the FDA, for example, has been alarmed at the number of people that are using stimulant-type over-the-counter products, as opposed to someone who under medical supervision may require an appetite suppressant, for example, which is also a stimulant, but is usually done under medical supervision. We're looking for extra energy, so one of the things we do is, in addition to a medication approach, we also give you the option of these energy shots, which are proprietary combinations of B vitamins and amino acids. It's kind of like the old B12 energy shot you get from your family doctor, except it's turbocharged with some additional ingredients.
Now, we're going to open up the lines to the audience for that. You can also check him out on his website. It is startclinic.com. You can call them direct at 602-795-3649. Or also you can check them out at they're located in North Phoenix, and that's near the Desert Ridge, right?
Yeah, it's on Bell. It's about midway between Tatum and the 51. So we're about 5 blocks east of Paradise Valley Hospital.
And our lines are open here. Our number here is 602-277-5369. And toll free, it's 1-866-536-1100. And everyone's getting entered in to win. I guess we're going to do it that way. It's fine however you want to do it. It's an energy shot that's containing the several amino acids. It's like on steroids. I don't want to say steroids because I know that's not the right thing to say, but what should you say?
Well, Carol, I would offer you the shot, but I don't think you need it. It might put you over the top, okay?
You're not the first one to say that to me. But our number here is 602-277-5369. And toll free, it's 1-866-536-1100. So you focus on diabetes and weight loss at your clinic. And is it because of what happened to you?
Well, I think I have a personal bias because of my experience with diabetes. So by default, I'm an expert in diabetes. But it's also because statistically, the incidence of diabetes is increasing rapidly. More and more people are overweight. The primary cause of diabetes is being obese. Obesity is scientifically defined as having a body mass index of over 30. But what that overlooks is that many people that don't even have a BMI of over 30 have the early stages of diabetes, have the early stages of comorbidity, because they have too much visceral fat. That's why we place an emphasis not just on what your percentage of body fat is, but also what is your waist size, because belly fat is a toxic organ. It's a manufacturer of pro-inflammatory hormones that will inflame your blood vessel walls and set you up on a pathway to what we call free radical damage. So if you have inflamed vessel walls, for example, it increases your risk of heart disease. So the diabetic who, even the person that's pre-diabetic, they're not even officially diabetic, if that happens to a man before the age of 40 years, he's going to cut 11 years off of his lifespan.
Wow.
Happens to a woman before 40 years, she's going to lose 14 years of her lifespan. And they're going to increase their risk for not only heart disease and cancer and dementia, but peripheral neuropathy, retinal disease. The number one cause of blindness in America is diabetes. The number one cause of amputation of limbs is diabetes. So we feel like we're in a battle. We're in a war. And part of that war is also convincing people that obesity is not a problem of vanity. Obesity is a problem of health. And, many people will want to come in for the vanity reasons because they want to look better, they want to feel better. And many times they don't realize it'd be much more important for them to understand the life risk factors that they're facing if they don't lose the weight.
Their phone number is 795-3649. It's startclinic.com, and our lines are open here for everybody to get entered in to win. It's this energy shot that you're getting that's containing several amino acids for energy, and our number here is 602-277-5369. So you just opened up this clinic recently. What are your visions for Start Clinic?
Well, we're the only clinic in the Valley that has a gym. So we're interested in not only helping you to lose the weight, but then teaching you how to maintain a normal body weight. And I'm a jock. I spent my life in sports and sports medicine. I'm a former volunteer physician at the Olympic Training Center. When I was there, I was assigned to judo, wrestling, and powerlifting. So, of course, my 12 kids are afraid of me. No, I'm just kidding. But I was taught by our Olympic champions how to do powerlifting. And so since my 40s, I've powerlifted.
Wow.
And I think the daily exercise regimen that I do and the nutritional supplements that I take are one of the reasons why even after 23 years on insulin, I have no physical evidence of retinopathy or renal disease. I have a little bit of neuropathy, but the complications that I've experienced from diabetes are very minimal.
We're going to go to a break, and when we come back, we're going to talk further. Our lines are open here. Everyone's getting entered in to win the energy shot that contains several amino acids. Our number here is 602-277-5369. Check them out at startclinic.com. We'll be right back.
if I traded it all.
So we're talking here with Dr. Glenn Halverson, and he is the owner and medical director of Start Clinic. Our lines are open here, and we're talking about, obviously, diabetics and being overweight and what that causes and why it's bad for you. And obviously being overweight, I don't care if you have diabetes or not, it's not good for you. We know that. We have our lines open here, and everyone's getting entered in to get a energy shot from them. It contains several amino acids. It's very different. It's very special that you've done this for people. That it's a little different. It's like if I took it, I'd be off the wall. Is what you said. And our lines are open here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out. They are located in North Phoenix. Their website is startclinic.com. Okay. So when we were at a break, you were talking to me, and I said, well, you said that you're one of the only medical facilities that also has a gym there as well. And I said, well, do I have to go to the gym? And nobody likes to go to the gym, Doc.
No, I understand that, Carol. In fact, we don't require you to participate in our gym if you're in our medical weight management program. It's just another option. It's really my belief, based on the science, that tells us that once you lose all that unwanted body fat, the best way to stay that way is to exercise on a regular basis. And we don't necessarily want you committing your life to our gym, but we do have a gym so that we can teach you exercise that you can do inexpensively and safely at home. So after you graduate from our program, you still have a way to maintain your health. Our primary approach really is the use of stimulant medications that are approved by the FDA that suppress your appetite. We do that along with behavioral management. We teach you foods that are good for you and foods that are bad for you. We're not going to give you recipes for every day. Obviously, there are different ethnic groups that come in for weight loss. The energy shots are really just another...
Do they help us lose weight? Because we want everybody calling in for losing weight, not just from an energy shot.
Yeah, we just want a shot.
Yeah.
We'll do whatever it takes, to help you to safely lose weight. Some people... are not medically appropriate for the prescribed medications, and they can take the shots. They can take what we call fillers, which are basically a pill that you take before your meal to
fill you up.
Yeah, to fill you up so that you don't eat as much. Because
that's what it's all about.
Yeah, the big culprit really is portion control. People eat too much. They eat too much of the wrong foods. And so we educate you so that you understand why you're gaining weight and what you need to do in order to lose it. We're not asking you to make your life perfect. We're just asking you to make some wise choices in several areas, whether it's energy output, whether it's energy intake, whether it's exercise. But to be honest with you, our gym is also for my kids. I train them.
You got 12 of them.
I've got a 17-year-old that put on 40 pounds of muscle in this past year under my direction. I thought that was pretty cool.
Wow. Well, let me also talk to you about those stimulants and what people can expect from, when they come in and they start doing this. How fast do they see the turnaround, and how fast are they going to see some results? Because that's what they want, Doc. They want fast results.
Great question, and in fact, we do have guidelines. When we put people on medications, we tell them that there are certain expectations in terms of loss of percent body fat, but we also evaluate their body composition. Because, for example, a patient may come in and we feel like they've lost too much weight too rapidly, and so we have a device from Germany called a Sika machine that will show that they're not just losing body fat, they're actually losing lean body mass. That's not healthy. That's why, for example, on our site, you'll see that we don't support fad diets like the HCG diet or the starvation diets, because those in the long run are unhealthy for you. It makes everyone look like a hero in the beginning because they're measuring your scale weight. And everyone's losing weight, but they're not just losing body fat. They're losing bone mineral, and they're losing lean body mass. And on a 500-calorie-a-day diet, for example, that's a starvation diet. You're not getting all the essential nutrients you need. And what happens is that type of diet is unsustainable. So once you go back to regular eating, many times what will happen is you'll gain back more weight than you actually lost. And what the patient doesn't understand, they didn't gain back the bone and the muscle that they lost. They gained back the fat. So they're actually fatter in the end than they were in the beginning. And if you look at the medical research, they've also put themselves at risk for irregular heartbeat, ending up with sudden death because of heart attack. They'll get electrolyte imbalances, and they'll have a hard time with normal activities, daily living, because they've lost so much lean body tissue.
Well, what I'm hearing from you, too, is it's not necessarily how fast you lose it, but how healthy the way that you lose it in the right way.
We're in it for the long term. And it's going to take at least 6 to 8 weeks before you see significant weight loss if it's done in a safe manner. We're really talking about the old proverbial guideline of 1 to 2 pounds a week. But if you look over a year's time, that's healthy weight loss. That's weight loss that you can maintain, as opposed to the person that dramatically loses 30 pounds in 30 days.
You can check them out at startclinic.com. You can also call them direct. Their number is 602-795-3649. They're located right in North Phoenix near Desert Ridge. And our number here is 602-277-5369. Get one of these energy shots and start feeling a little bit more energetic like me. I want to also go into with these stimulants. Are there different ones that you have for different people? You know what I mean? Because do you mix them? Are they? I want to know more, Doc, about them.
First of all, everyone gets a complete medical evaluation. They get their body composition. They get an EKG. Because if you're going to be on a stimulant medication, we need to make sure that you have a normal heart rhythm, that you don't have a contraindication. You need to have normal or near normal blood pressure. So there are a number of risk factors that would contraindicate a person from being on the stimulants. And in those patients, we use different alternatives. But in terms of the medications, yes, there are a number of different medications. In fact, there are several medications that have just been approved by the FDA in the last couple of years. Back in 10 years ago, when I first looked at the American Society of Bariatric Physicians and went to a number of those meetings and so on, was considering this, we only had basically 1 or 2 main medications. And now there's a plethora of medications, and particularly when you talk about diabetics, there are 4 new medications approved within the last 2 years for diabetic control. But there's still, it's kind of like the blood pressure story where we have all these expensive new medications, and yet the most effective, most affordable medication for elevated blood pressure is a diuretic that costs pennies compared to hundreds of dollars a month. And we have medications like phentermine, which are an FDA-approved stimulant since the 1950s. And that medication still works. The difference is that when it was initially approved, it was approved only for 6 weeks at a time. Well, how many people are going to lose a significant amount of weight in 6 weeks? Not very many if it's done in a healthy fashion. So there's a growing body of evidence that stimulants such as phentermine, for example, are safe when used off-label. In other words, not approved for more than 6 weeks, but we use them for more than 6 weeks. And more Obesity Medical Association physicians are finding that patients have to be on these medications for a longer period of time in order to continue to lose weight.
Well, the best thing I think that people should do is find out whether they're a candidate. I think that's the first and foremost thing. Does it matter either if they're how much overweight they are or if they're too overweight? Does that matter?
No, it doesn't. It's going to take longer.
Sure. But I mean, there's some people have like
obese.
A thing where you have to lose a certain amount of weight before you can start, but that doesn't matter.
Well, losing a certain amount of weight before you start really probably has to do with the physical activity level. If a person is morbidly obese, exercise may not be a good idea. And in fact, in most cases, exercise and diet alone don't work for those people. They need a combination of things, including a medication approach. But it takes education. In fact, it takes us educating our primary care physicians who are referring, because many of them are not experienced with appetite suppressant medications, and they may be concerned about even their patients being on them.
And the stimulants that they're all safe. That's what I want to know too. Is it safe?
They're safe if they're used properly in a supervised medical environment, and if you're honest and pay attention to the relative contraindications.
And that's what they provide for you. Now, they're located in North Phoenix, right near Desert Ridge. Their phone number direct at 602-795-3649. Their website is startclinic.com, and I'm going to let you call throughout the rest of the show. They are entering everyone in to get this energy shot that contains several amino acids. It's for energy, and if you guys all feel, not like me, but like a lot of people out there, you know you could use it. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out. It's startclinic.com.